The Muir Maxwell Epilepsy Centre at the University of Edinburgh is a hub of clinicians and scientists whose focus is trying to improve the care and management of children with epilepsy. About 600,000 people in the UK have epilepsy, and affects about 1% of children. But in 70% of cases, we still don't know the cause. And in 3 out of every 10 children, they don't respond to any of the treatment options that we currently have available. And we now realize that a substantial number of children with epilepsy will have more than just seizures. They'll have learning and they'll have behavioural problems. The centre's work is really around patients and their families, and it's driven largely by their needs and by their observations. And so they're central to whatever we do.
Max is 12 years old and he has Lennox-Gastaut syndrome. He was diagnosed with infantile spasms, West syndrome, as a baby. Max's quality of life is significantly affected. He does have good days, but more often than not, he's not very good. He has seizures daily, and these seizures can impact on his balance and coordination. He can be very sleepy, and it can affect his appetite. Sometimes he just doesn't want to eat, and it can affect his sleep as well. He can be wakened up quite a few times in the night due to seizures.
The multidisciplinary approach that we have really reflects the complex nature of epilepsy. It's much more than just the seizures, it's all the other things associated with that. So it doesn't just affect the child, but it affects the family and has effects on the community as well. So our research focus is by its very nature collaborative to address all those different aspects. We're uniquely placed in Edinburgh. There are very few places in the world at all that are able to adopt this collaborative approach that we have. So we have world leaders in preclinical basic sciences looking at brain tissue. We have experts in informatics. We have experts in imaging. We have the NHS, in which we have free point of care, and being able to draw on those resources and putting them together, and doing that along with social scientists, doing that along with psychologists and psychiatrists. We're really uniquely placed in order to address epilepsy as a whole rather than in its individual parts.
We know that underneath it all, that little boy is still under there. So really it's just to try and get a little bit of him back again. I'd love to see, we haven't heard Max laugh out loud in about 4 years now. He used to have a wicked laugh, so to be able to hear him laugh, show emotion to family members, just have a better quality of life would be the most important thing to us.
Hopes for the future is to make big inroads in the 3 main questions. 1, what are the causes? I'm hoping that we will be able to identify much more causes, and in particular trying to help to prevent the onset of epilepsy altogether. 2, if you do have epilepsy, I'm hoping that we will have development of novel treatment strategies, not just with drugs, but with other approaches as well. And the 3rd thing is that I'd like us to be much more aware of the cognitive and behavioural problems that are associated with epilepsy. So recognising them earlier and treating them earlier and making a big difference to the families.
The research that's been done at the Muir Maxwell Centre really is so important for children like Max, for their futures and any future developments into epilepsy. We've really lost him to epilepsy, so any research that's been done is very important.